In this lecture, we will cover accumulation of proteins. We have covered already accumulation of cholesterol and fatty changes. Now we are going to discuss accumulation of proteins. Now you can understand proteinuria. We have discussed in detail, but I am going to tell you more. In proteinuria, reabsorption of proteins increases. So when reabsorption in tubular cells from proximal tubular cells increases, then protein gets accumulate inside the proximal tubular cells. As you can see in diagram, after staining with H and E, we can see the appearance of protein as pink hyaline droplets. As you all know, our body has a strong immune system, and antibodies are major part of our immune system. Antibodies are involved in binding and then removal of antigens to protect our body from any harm. Antibodies are immunoglobulins in nature. It means antibodies are protein in nature. Antibodies production is controlled by the plasma cells. Whenever antibodies produce, a large quantity of cytoplasmic nucleons form within the cytoplasm of the plasma cell. How nucleon bodies are formed? Antibodies, excessive production of antibodies gets accumulated inside the cytoplasm, inside the rough endoplasmic reticulum of the cell, and this rough endoplasmic reticulum converts into inclusions, cytoplasmic inclusions. These cytoplasmic inclusions are known as Russell bodies. And as you can see in diagram, after H and E stain, Russell bodies appears on microscopic examination as red or pink or like eosinophilic homogeneous structure. Now third one is defective intracellular transport and secretion of critical proteins. Some proteins have critical role in our body like alpha-1 antitrypsin. This protein breaks an enzyme known as elastase to protect the breakdown of elastin. For example, in our alveolus, elastin layer is present to provide elasticity and strength to alveolus. During any infection in alveolus, neutrophils, being a major part of our immune system, secrete neutrophil elastase enzyme. This enzyme removes the infectious agent, but elastase removal is also necessary because elastase start breaking down of elastin of alveolus. For removal of elastase, fortunately alpha-1 antitrypsin released from liver, which cause breakdown of elastase to protect elastin layer. So genetic deficiency of alpha-1 antitrypsin can cause accumulation of elastase in different sites. Fourth one is very simple. During any abnormality, cytoskeletal protein can accumulate in cell in abnormal amount like microtubules, actin filaments, myosin filaments, intermediate filaments, and few others. Another important mode of accumulation of protein is proteinopathies or protein aggregation diseases. For example, in amyloidosis, misfolding of proteins happens during formation of proteins. These misfolded proteins get accumulated in cell and extracellular spaces. It was an example of aggregation and accumulation of abnormal proteins. Another important substance which can deposit in cell is glycogen. As you all know, glycogen accumulation commonly occur in patients with metabolic disorders like in diabetes mellitus or other glycogen storage diseases. As you all have studied in biochemistry, glucose stores in the form of glycogen by the process of glycogenosis, and glycogen breakdown occurs to provide glucose to the body by glycogenolysis, but due to any genetic storage disease or abnormality in metabolism, glycogen gets accumulated in our cells abnormally. Now I am going to discuss accumulation of colored substances in the cells. Colored substances may be endogenous or exogenous. Some examples of endogenous pigments are lipofuscin, melanin, and hemosiderin. Hemosiderins are usually derivatives of hemoglobins. Now another thing we are going to discuss is exogenous pigments. Most common exogenous pigment is carbon. Carbon is one of the common air pollutant. Whenever carbon enters in our lungs, our alveolar macrophages come in contact with carbon and phagocytose it. After phagocytosis of carbon, macrophages transported it through lymphatic channels. In lymphatic channels, aggregates of carbons blackens the lymphatic channels. Now we are going to discuss endogenous substances. Endogenous substance, first of all, we are going to discuss lipofuscin. Lipofuscin is produced by free radical injury. Actually, it is a complex structure of lipids and proteins which is produced after free radical injury of radical peroxidation of polyunsaturated lipids. यूएचएस के लिहाज से ये बहुत इम्पोर्टेंट टॉपिक है लिपोफ्यूस्किन का. बहुत सारे एमसीक्यूज इसमें से आ चुके हैं. नाउ वी आर गोइंग टू डिस्कस we have already discussed free radical injury. In aging, free radical injuries are increased, so this pigment gets accumulate in cells and give brownish yellow appearance to this cell. Now the second endogenous pigment is melanin. Melanin, all you know, we are facing ultraviolet radiations in our daily routine. So in our epidermis, naturally we have defense system against ultraviolet radiations. Melanocytes are present. Melanocytes protect our body cells or skin from harmful ultraviolet radiation by the production of brown black pigment which is known as melanin. So melanin protects our body from ultraviolet radiations, but during excessive production of melanin it gets deposits in surrounding cells and give brown black appearance. Now another important endogenous pigment is hemosiderin. Hemosiderin is released by the lysis of RBCs. Iron is released by the lysis of RBCs. Actually it's a form of iron. Iron is most important component of our RBCs. Iron released after lysis of RBCs, or if anyone is taking iron from outside, iron become high in our body locally or systemically. This iron stores with apoferritin. Apoferritin is a protein used to store iron inside the body. ठीक है. These apoferritin forms ferritin micelles. Large aggregates of ferritin inside the cell are representation of hemosiderin. Hemosiderin or ferritin aggregates can be visualized by electron microscope, but in our daily or routine examination or in histochemical setups we can observe it with Persian blue stain. It is very important in UHS. Many times we have faced an MCQs iron staining regarding iron staining. So Persian blue stain is used for the staining of iron. Now hemosiderin accumulation can be pathological as well. In case of hemosiderosis and hemochromatosis, hereditary hemochromatosis, it's a genetic disorder.